Well, good afternoon, everybody. My name is Garrett Schmidt. I'm the managing editor and CEO of ACOexhibithall.com. I'd like to welcome you all to today's webinar. It's hosted by Stellar Health with a special guest of Vitalize Health. And it is called Achieving ACO Success by Engaging Provider Group Staff. And a few items of note before we get started, just some housekeeping items. Everyone has joined today in listen only mode, so you don't need to worry about muting your microphone. That has been done for you. And then second of all, we want to hear from you during the presentation. So please ask your questions. You'll see on your little attendee module, there is a place that you can ask questions. There's a chat too, but ask if you're going to ask a question, ask it there. In the question module, and then we'll get to as many of those as we can during the Q&A session toward the end. And you don't have to wait till then in order to ask. So at any point, please submit your questions. If we don't get to your question, we'll make sure to answer it via email afterwards. So please don't hesitate to ask, even if we're wrapping up. And then finally, the webinar is being recorded today. And so you will have access to that recording that you can share with colleagues or rewatch, and we hope that you do. So what's going to happen is after the presentation is done, I'm going to send out an email to everyone who's registered, and that email will have a link to where you can actually view the recording and the presentation, as well as download the slides, and also access the Stellar Health exhibit hall booth, which I'll tell you a little bit more towards the end. So without further ado, I wanted to introduce our speakers today very briefly, and they'll do a little bit more in-depth introduction. But our speakers today is Zach Kaplan, who's the Director of Provider Network and Strategy with Stellar Health. And then hiding in the background because of a camera issue, we've got Eric Rogo, who is the Senior Vice President of Growth and Network Development with Vitalize Health. So welcome, gentlemen. I believe Zach is going to get us started off.
Perfect. Thanks, Garrett. Really appreciate the intro, and thanks again to you and ACO Exhibit Hall for having us. Really excited today to jump in to talk a little bit more around how we think about driving performance within ACOs, especially focused around how do you engage both providers as well as the care teams at the point of care to really be able to drive to superior results. Garrett gave a bit of a quick intro, but maybe just to jump in a little bit deeper about who are these guys talking to us today about value-based care. I'm Zach Kaplan. I lead the provider side at Stellar Health, come from a background in consulting all different shapes and sizes of provider groups, health plans, all really trying to think about how should they invest in this shift over to value-based care. At Stellar Health, what we focus on is how can you help provider groups really be able to drive performance on their value-based care contracts? And the way in which we think about that is how do you break down these different value-based care metrics, whether that be quality, coding, total cost of care initiatives, into the what is it on the day-to-day basis that you need your providers and staff to be doing at the point of care in order to be able to drive to these superior outcomes? So what we do is we actually help prompt at the point of care, very granular prompts of here are a few things we recommend you do with your patients inside your office or outside of your office. And then what's unique about our model is we actually partner with whoever is the risk-bearing entity, so in many situations, ACOs themselves, to actually reward the completion of these tasks in real time. Essentially what we've done is help create a fee schedule for some of these very granular value-based care activities to be able to drive these very granular real-time types of prompts and incentives. We'll get into it more today in terms of really how we think about why including both the provider and their staff in these types of rewards can really drive value. But we work with everything from large health systems who are taking on full risk across their entire book of business, all the way down to individual, independent primary care providers who are really just trying to think about how do I take that next step into value-based care. And so really excited to be joined today by one of our ACO partners, Vitalize. So I'll pass it over to Eric to introduce yourself.
Thanks, Zach, and thanks, Garrett. Previously, sorry everyone, my camera's not functioning with this program, but really thrilled to be here and help represent Vitalize Health as we do partner with Stellar. It's one of our key programs that we use. We are an ACO and DCE, and we are working on global risk contracting as well. Just to tell you a little bit more about myself, I've been in healthcare for about 20 years prior to Vitalize, which I've been close to 4 years now. I was in the pharma industry, so apologies for that. But I have had many years of working with practices and understanding sort of a little bit about what makes them tick, and just the whole perspective, which we'll talk a little bit about today. I think in terms of making progress in practice engagement, you have to just really have an understanding of how they feel and their perspectives, the practices, and letting them know, that you recognize that they're going through these challenges. So we'll talk a little bit about that today. What we do at Vitalize Health is we look to transform practices, approaches to value-based care and really support success there. We work with hundreds of providers, hundreds of practices, hundreds of doctors, and we work with ACOs currently, IPAs, hospitals, and independent practices to help improve their approach to treating patients and improving quality, lowering costs. We use 4 main components: financial incentives, which we'll talk about, technology, virtual clinic, and of course the practice engagement, which definitely goes hand in hand with all the other parts.
Perfect. So focus of today's discussion, as Eric shared a little bit about, is really around how do we help ACOs, whether you be a health system, independent practices, whether it's Medicare, commercial, other different types of value-based care programs. How do we actually drive sustainable results, right? Not heartbeat results where one year you do great on shared savings, next year it's challenging. How do we actually make sure we are doing the day-to-day appropriate activities, again, on quality, coding accuracy, total cost of care, that are able to drive these types of superior results? And what we really find to be one of the key aspects of that is, how do we actually make sure we are positioning not only our providers, but their full care teams, their medical assistants, their nurses, their front desk staff, to be able to help drive these overall results? So maybe just to start a bit with, well, where are we today? Probably everybody on this call, is tied in some way to this whole idea of value-based care, right? Really, we all believe in the whole idea of this is where we need to shift, as it really does emphasize the importance of keeping patients healthy, right? Making sure that we are shifting from retrospective to prospective in terms of the type of care that we're providing patients. But we've all been on many different webinars, right? It has been decades since we've been talking about value-based care. How come we still are where we are? Well, if we think about some of the different challenges, we really want to start to put ourselves in the shoes of how do providers think about that? Number one, it's really difficult and uncertain as to what does it actually take to drive value-based care results, right? How, as a provider group or their staff, are you able to consistently perform on these metrics, and what does it take on a day-to-day basis in order to make sure that we are hitting our quality goals and other different types of metrics? Next, one of the most challenging things about value-based care is this whole idea of incentives really being misaligned, right? Provider groups are asked to invest in resources today, all with the promise of, I hope 18 months from now, right, at some point I'm able to get some check of shared savings. But by the time I get that check, I'm really not sure exactly what it is I did in order to earn that, right? It's really difficult to be able to tell what I do today, how does that translate into results? And then lastly, right, really this whole idea of being able to think about things in terms of workflow, right? It's really difficult for, hey, I have my day-to-day in terms of what I'm used to doing, how I'm used to using my EMR. How does this whole idea of value-based care really fit into that? Right, and if we break this down into a couple of different types of challenges, number one, right, there's chaos, right, in terms of shifting metrics. Every year, CMS comes out with new metrics. Each health plan comes out with new tiers and ways in which they're structuring what the metrics are. So it's really difficult for a provider not only to know how they can perform on those metrics, but even just to be able to track on a day-to-day basis. Right. Second, we really think about this whole idea of a provider doesn't think in terms of payer by payer, right? The way they think about workflow is all about who is the provider that's in front of me, what does the patient need? Which line of business are they, right? Isn't necessarily a consideration where they have to think about, well, which workflow tool should I go to, which portal, which spreadsheet, right? It's just about, hey, Jane Doe's in front of me. What are the 3 to 4 things I need to know? I shouldn't have to worry about, oh, hold on, they're a Medicaid patient, so that means it's these metrics, right? It's these rules for when a screening needs to happen. Right? Those are all really difficult things for providers and their staff to be able to track. We hit a little bit on this, but the whole idea of misalignment of incentives, and especially that whole idea of timing, right, where we're asked to make a trade-off today, right? We say, hey, can't you just spend these extra 5 minutes for patients? We know it will go a long way in terms of value-based care performance. But they say, well, hold on a second, those 5 minutes take me away from something else I could be doing. Maybe that's, office visit, an extra third of an office visit that I could have gotten in. And if that office visit would earn me $100, then yeah, it's easy to say, hey, can't you just spend these 5 minutes? But that 5 minutes then just cost them $33 of that $100 visit, right? So how are we making sure that they have aligned incentives to actually spend the time on what we want them to spend on? And then lastly, this whole idea of really being able to translate into provider-related solutions, right? A lot of what's been out there to date has been in the eyes of the payer of, hey, we want to drive risk adjustment results. We want to drive all different types of metrics, right? But are we really putting ourselves in the shoes in terms of the way in which on a day-to-day basis a provider and their staff thinks about it? Just a couple of other examples in terms of some of what we've seen out there, right? This whole idea of metrics really being different by health plan, by program type. I mean, even between Medicare Advantage and ACOs, 2 of the largest programs for Medicare, right? There's not that much overlap in terms of exact same quality metrics, not to mention other CMS programs, Medicaid, state by state, in terms of what that looks like if you have an ACO that spreads multiple different states, right? So just always remember about this whole idea of, are we actually putting ourselves in the shoes of providers who have to manage all these different types of metrics? Oftentimes we see these cliff problems with benchmarks, right, where they're measured on a percentile basis. Maybe it's, hey, if you get over 70% on your colo screening, right, then we'll give you this extra bonus. But if they're sitting at 25%, right, then they're really have a difficult time with incentives being able to get all the way up to 70%. If they move from 25 to 65%, right, they've actually made a lot of progress. A lot more patients are getting their colo screening, right? But in the whole percentile tiered structure, they haven't earned anything else. So it's really difficult for them to actually invest in it if they don't feel like they're going to be able to get rewarded for that extra effort. There's also this whole idea of retrospective measurement, right, where it's really difficult to even know how do you stand on that percentage throughout the course of the year. By the time they actually see, we're looking at during the following year what their previous year's metrics were, right, it's really hard to actually make real-time changes as to what is it that I need to do. And it becomes really frustrating for providers to be able to say, hey, I'm not even sure where it is I stand. How do I know if I should be focusing more on colo screenings or breast cancer screenings? Or, how am I doing on my medication adherence days? That's something that can quickly fall off if you're not paying close attention to it, right? So it's really important to be able to have that type of real-time metrics. And some of this stuff, right, isn't necessarily in the control of each of the providers, right? So how do we really boil it down into, well, what is it that you should be worrying about versus someone else worrying about, and making sure that we're really framing it in that direction? Can't have this discussion without also bringing in, well, how has this been emphasized with the pandemic and all that we've seen, the extra pressure that this has put on practices? A big shift has been, of course, focus appropriately on COVID response and what that's meant in terms of, reduction in kind of some of the typical services, right? Being able to get people in for annual wellness visits, being able to make sure that we're also prioritizing some of our chronic patients and making sure that they're getting the appropriate level of care. The emphasis on fee-for-service has made it even more difficult for some of this transition, right? Where those who are really built around this fee-for-service model saw a massive loss in terms of the amount of visits that we're seeing, which made it even more difficult to make the business decision to invest in this whole idea of, extra technology or other different ways to really be able to shift to value-based care. So something that's made it even more challenging. And then to top it off, there's been extra shortages in terms of staff. We're seeing from nursing to medical assistants to front desk staff, practices really having trouble not only obtaining talent, but making sure that they're retaining it, right? So how can they actually think about, given the current circumstances, making sure that they're bringing in good team members? So with that, wanted to pass it over to Eric. Maybe you can share a little bit more on some of the other challenges you've really seen and heard as you've been out there talking with all different shapes and sizes of providers.
Yeah, sure, Zach. I'm sure a lot of these leaders have heard the same things when practices say, well, my practice is different, or I can't handle this work. We've heard a lot of the same verbiage from these different types of practices. And, candidly, they have a lot of obstacles because they hear a lot of different voices themselves. Everybody's asking them to do something unique, but the main core of it is the same, and it's prevention. And we focus a lot on prevention and sort of trying to simplify the messages to the practices. That's one thing that Stellar technology does well. But these conversations with the practices, really pinpointing what they need to do to reduce those future costs. So that's a big thing that we try to do. And we really try to let them understand that we're their partner. We're not somebody else that's coming out there trying to make things more difficult. We're trying to simplify these things for them. Who runs the practice? Sometimes the doctor, but it's usually an office manager. So really building a strong relationship with them, letting them know that we're on their side. Those are some of the main points. I mean, they're pretty broad, but I believe that they're pretty common. And we'll talk a little bit further in the conversation about how we configure solutions to meet these practices' needs. But understanding that their main goal is to help patients, and all of these measures and all of this coding and all these different types of preventive things are not taking care away from patients. I know sometimes they feel like they're restricted, but with this overall goal of lowering costs, well, you can lower costs a lot more if you prevent an event than if you just focus on directing people to the right place when an event does occur. So we could talk more about that.
Thanks, Eric. And so, what have we seen that's kind of been some of the silver lining from some of this shift? A big piece of this has been increase in different forms of access. We've seen additional efforts around telehealth and providers who had never really used telehealth before starting to make a push there in terms of being able to provide that more for their patients. We have seen some providers who have often actually used this as an accelerator in the whole effort to be able to go shift to value-based care. I think one of the big things here has been really looking for a partner who can help you drive that to the next level of value-based care. I think it's been great for, Eric and the Vitalize team. Part of what they've done, right, is really been able to partner with, some of these different independent practices who have had a hard time being able to make the shift by themselves, right, and really are looking for a partner who can bring some of those different resources that are, difficult when you're also trying to maintain your independence. And then I think the other big thing is more and more people are really talking about the whole idea of physician and staff burnout, right? And how can we come up with, not just more clicks, not just more ways in which, physicians and staff are adding things to their plate, but how are we doing that in a more methodical way where we're really able to start to be able to drive a better experience for the physician and their care team? I think overall, right, in terms of kind of some of the different lessons learned is really how are we making sure we're actually increasing this whole idea of teamwork and better communication within the team? How are we able to create a flexible model, right, where as there are these different types of shifts in terms of priorities, where there are team members who can help, bear the load in different ways, and also really understanding that, in order to get to these different value-based care goals, it takes incremental steps to head in that direction, right? How do we do this with the current staff that we have? How do we think about, how this fits into some of our other different types of programs, our, additional telehealth services? What does that mean then in terms of the way in which we think about documentation and other pieces of processes? And also a big piece of this has been, the whole idea of really focusing on other social determinants of health. One of the big ones that's been out there is the whole idea of, transportation, right? Are we actually helping our our patients get into the office is often one of the biggest things that we really saw get emphasized is just this whole idea of, if we have an open time slot, are we calling the highest priority patient to make sure we get in there? Are we able to flag whether or not that patient is able to come in? And if they can't, right, are we able to point them to other different types of resources, whether that be in home programs, whether that be ride services, right? How are we making sure that nobody falls through the cracks, especially, when resources are constrained? It becomes even more important that we're thinking through what are kind of our enablers to make sure we're focusing on the right places at the right time. So Eric, maybe before we get into a few more tactical suggestions, would be helpful if you don't mind just sharing a little bit more around kind of how you started to think about, as Vitalize, partnering with some of these different types of IPAs, PCPs across the country.
Great. So we focus mostly on independent groups, but we do work with practices that are owned and, where there's a leadership team there, and help to determine success plans for those types of groups as well. As you can see, we work with ACOs, IPAs, clinically integrated networks, small hospitals, large groups, independent practices, whatever shape and size you are, and we like to meet you where you are. So some practices and groups have never been in value-based care. And then there are people who are very successful. They're looking to take it to the next level, or anywhere in between. So I think meeting them where they are and helping to determine a goal that works for that provider group leadership team is really a critical part of this process. The next thing is, a lot of these groups say, well, how does the process go? You can go back to the previous slide. They'll ask, how does this process go? Well, we like to configure a solution. Can't customize everything, but take what we have, take what you have, and configure a solution that works. For example, we'll work with one group and they might have one population health system. Well, we would never ask anybody to change that. It just confuses the whole process moving forward. So we work step by step with different facets of your team to determine, for example, okay, you have 50 practices here. They're interested in participating in this type of program. How are we going to engage them? And each of these practices will work differently with us and with you. So we develop a plan there that helps create a stickier engagement process. And we have about 85% engagement with the groups that we work with, which is really quite good. There are a percentage that will never be engaged, right? We have to understand that that happens. And then what do we offer? It's no cost. We offer clinical team, technology, administrative health, growth capital. So we develop arrangements and then relationships with practices so that they don't feel like they're taking on an additional financial burden. And so then we can help them engage in what they want to do in terms of succeeding in the value-based care model. You could go ahead to the next slide. Possibly. The next slide move. It's stuck. So I'll talk a little bit more about, so what does that process look like for practices? So it's getting a very solid understanding of how the practice is put together, who are the key players in that practice, who's going to be making the decision, sort of letting them know we really understand what they feel, and talking to them about our previous successes and how we can flex things to make it work with their process. Right. One thing that's really nice about Stellar, and it's EMR agnostic, for example, you can work with different practices that say, okay, the patient comes in, the Stellar tool, you can identify who that patient is through the practice management system. The person at the front desk, they print out some really nice summary sheet. Maybe you slide it in the little slot outside the door for the doc. The doc checks off a couple things. Someone on the staff takes 2 minutes to enter those quality measures or coding, whatever, in the system. That's an example of flexing based upon how the process flow works in the practice. What technology do they have in the practice? And it really trying to seamlessly do it so that they don't feel it. I think that that's really critical. Another thing that's super important is consistent, timely conversations with these groups so that they know, okay, what are you going to cover? When are you going to try to do this with us? And how much information? It's all about the big picture and then small bits and pieces that they can handle in their own way. And recognizing, for example, they say to you, today's not a good day. Well, guess what? We have to change our priorities and recognize that today's a terrible day for them, right? When COVID, just to go back to when COVID happened, we did a lot to help support practices. They couldn't see their patients, giving them telemedicine. I know Zach talked a little bit about telemedicine, but one great thing, and you probably see this in all of your organizations, is you get tons and tons of data. Well, practices don't want to look at thousands of lines of data and all these different cells, but if you can simplify them and tell them an actionable item in a simple way, it can help them address problems as patients come in, for their next visit. Thanks, Zach.
Thanks, Eric. Is the 4 ways to engage the team coming up now?
Yes.
The slide shifted again. Perfect. It wouldn't be a virtual conference without at least a small technology hiccup. So what we wanted to shift gears a little bit into is, how do we shift from, talking about some of these different issues and strategies into what is it that we can really do to be able to drive and engage the team, right? And how do we think about this again from okay, we can come up with kind of our strategies, our analytics, our figuring out which patients do we want to focus on, where is it that are driving our cost issues, where are we seeing, good performance in terms of quality, poor performance in terms of quality, right? But really, how do we actually go feed that into the way in which the providers and their staff think about the day-to-day in order to drive that outcome? Right, so what we've done is broken this into a few different kind of categories and ways in which we think about it. The first of which is really this whole idea of we really got to make sure we are thinking about things in the way in which a provider and staff do in terms of workflow. I think a classic example of this is that, most of the, especially quality metrics, but otherwise too, we have been thought about in a very binary way. Classic example of a colo screening. Is it incomplete? Is it complete? Right? That's often how, CMS, health plans have really thought about these metrics. But we all know, right, there are a lot of things that actually go into making that happen at the provider and staff level, right? First, you might need to actually call the patient to get them to come into the office, right? Then you need to make sure the provider knows they're eligible for a screening and that they actually spend the 5 minutes convincing them that it's something that they should go do. Right, then maybe your front desk or one of your care team members actually gets them scheduled at a preferred provider, right? Somebody who's within the network. Then you might even call the patient the day before the screening, make sure they understand their prep, make sure they know where they need to go and that they're all set, right? And then lastly, none of this matters in the eyes of, CMS unless you actually get the results appropriately submitted in order to get credit for getting that complete, right? And so the big thing here is how are we making sure we are focused on each of these different workflow steps? And I kind of like to frame it as what is it that I need to do today, right? Hey, for today, all we need you to do is focus on calling that patient and get them to come into the office, right? Once they're in the office, we'll focus on the few other things that we want to make sure get addressed while they're in their office. But for today, right, we just want to make sure that you're calling the patient. And one of the big things you'll notice here, right, is a lot of these categories are actually the staff and not just the provider, right? It's really important that the provider knows, hey, this is a patient who's eligible for the screening, or, this is a patient who you should talk with about their COPD or their diabetes, right? That information going from the staff to the provider right before the visit is critically important. But a lot of the other activities that actually take in order to make sure you're getting credit on these different metrics are really come down to each of the different staff members, right? And one of the things that I think is important is to remember this isn't going to be the same at each of your different practice locations, right? It depends on staffing structure. Is this a group who is, just a doctor, an office manager, and one front desk staff? Do they have central team who are the ones who call each of these eligible patients, right? What does their day-to-day workflow look like? Do they do pre-visit huddles where they talk about who are the patients who are coming in? All of it really comes down to what are the specific workflow steps at that provider's practice, right? And how do we think about making sure we're fitting in these key pieces of information of what needs to happen when into those right pieces, right? It's only helpful for the provider to know this patient had COPD and diabetes and needed their blood sugar checked. before they come into the office, right? Once they've left, then you've got to go get them back into the office again, right? Or to do a telehealth visit, et cetera, in order to make sure you get that chance to address anything you missed, right? So it's all about how do you feed that into the whole prospective workflow. I think the next big piece of this, as we talk about, hey, this isn't just the provider who's participating, right? The provider is critical to making sure that these different types of value-based care activities happen, but it's not just that provider. And even within that, right, it might be one individual provider, not the whole group of provider. How do we shift this whole idea of shared incentives to individual contributions that drive higher performance, right? Instead of, hey, everybody gets a percentage of the shared savings check based on how many lives you have, how do we actually tailor that to, well, who's doing what we know drives to shared savings? Who are the ones who are really pulling their further weight, making sure they're doing well on these different types of metrics? Or, if you have two front desk staff and one of them is calling patients twice as often as the other one, how are you able to track and reward that and really make sure that not only the provider, but the staff are being tracked as to what they earn? At Stellar, we'll often partner with some of the different provider groups where we can actually track on a day-to-day granular basis who did what, both the staff and the providers. We can distribute in all different forms of methodology. It can be, hey, we want all the medical assistants to get 30% of what's earned each month and split evenly. It can be shared out as individuals based on what they perform. So again, lots of flexibility around what this model can look like, but how are we making it as real as possible to the doer of the work, that they're able to see their individual contributions are really being recognized as they're driving higher performance. So maybe with that, Eric, I'll pass it over to you to share a little bit more on how Vitalize has thought about this.
Yeah, thanks again, Zach. So 2 points that I'd make is one, selecting specifically with Stellar's usage, how we use Stellar, selecting some things that you want to emphasize. And so Zach's talked about annual wellness visits. It's probably TCM. I mean, there's no secret, right? Everyone's working on a couple of these same exact things. So pick some things that are really important to you and increase the incentives, maybe through the Stellar tool, which, by the way, I don't know if Zach had mentioned this, but you could use this for a variety of different types of plans. It's Medicare fee-for-service ACOs, Medicare Advantage, commercial, I believe. But anyway, that's one thing that's really important, is you can help incentivize. The bigger the incentive tends to get more actions. So that's the first part. The second thing I would recommend that we found is practices. We're going to talk a little bit more about engagement and equaling success. But when your staff gets a piece or someone in your staff gets something, it creates a better success rate. So docs sometimes don't want to part with $1, but if they part with $1, the balloon gets bigger, right? And I know it's a little counterintuitive. Having that discussion with practices sometimes doesn't go, in the right direction, but that's something that we found to be very, very important, is if you give a little, you will potentially save more, right? So for example, if your person at the front desk is more incentivized to call 50 people for annual wellness visits or follow up on colonoscopies or whatever it is that you pick, you're going to see better results down the road, doc, which is going to lead to better savings. So you paid them an extra $100, that goes a long way for them. And so that's one thing that we found really important.
Agreed. And I think one of the other big things is, in terms of kind of this whole idea of prioritization of types of actions and types of metrics, is also how can you build in ways to be flexible, right? Where we all know at different points in the year, there are different priorities. In the beginning of the year, it's important to get, some of your AWVs and high-risk patients in. Towards the end of the year, oftentimes it starts to shift to, which of the quality metrics we're falling behind on, what chart chases do we need to do? How do you actually start to flex that throughout the year, right? Where you can actually create a flexible model where you can shift incentives to say, hey, this provider is really falling behind on medication adherence. We want to make sure that we're prioritizing that. This other provider is doing great on colo screenings, but really poorly on breast cancer screenings. How do we start to create enough flexibility where there's still, transparency in terms of what can they earn dollars for doing, right? But you're actually able, as the lead of the ACO, to be able to help shift and set these priorities over time. I think the other big piece of this that we've alluded to, but maybe just to call out a little bit more explicitly, is the whole idea of how do we actually make sure that everyone on the team is doing their part in this whole idea of value-based care, right? Again, a lot of focus on the physician, which is super important, of making sure that they, are understanding, well, before the visit, what are the few things I should talk with about the patient, and make sure I know, hey, even though they are new to my practice, historically they had all these other things coded at their previous provider, or, if they spent half the year in New York and half the year in Florida, do I know what's happening while they're down in Florida when they're back in New York? How are we making sure, right, nurses, care coordinators, and others are helping really, make sure we're coordinating things like, hey, after they were discharged, are we reaching out to them appropriately? Are we coming up with appropriate care plans, right? All things, again, that they're working on, but how do we make sure that these things are appropriately prioritized and incentivized? And then, of course, as we've called out before, the whole importance of the medical assistant, the front desk staff, the scribe, depending on what the staffing structure looks like. And I think one of the biggest things we've seen is not only this idea of outreach to some of these different priority patients and documentation, but I think really one of the things that has been a bit the secret sauce for Stellar is this whole idea of making sure they are helping queue things like patient forms for the physician. One of the things I kind of jokingly will often talk about is the tap on the shoulder phenomena, right? Which is every physician has their go-to person who says, Dr. Smith, don't forget these 3 things when Jane Doe walks into your office today, right? And so by allowing that medical assistant, that front desk staff, whoever it is that helps with that pre-visit planning, actually share in some of the rewards for when the physician closes their 5 care gaps. For example, the medical assistant gets to keep 30% of those dollars earned, really goes a long way to make sure that information gets into the hands of the physician at the right time. And this whole idea of shifting from prospective to retrospective. I know, Eric, you guys have really focused on this whole idea of leveraging office managers, medical assistants to be more and more involved. If you want to add any other further color there.
Yeah, I just agree completely. I mean, the more you get the practice engaged and not overwhelming them and letting them know that it's a team effort. I mean, we have our own team that is directly linked to specific people in the practice. So we try to, one, always respect who's ever leading that practice and not try to take away any autonomy, take away any decision making that has not been approved by the practice. I mean, that's actually a very critical component of building trust and engagement, is letting them know an outside party will not step over the lines in terms of what they feel is important in their management. So never do we do anything that steps on their toes. So they always feel like they're in control of all the decisions and all the any funding, right? It would go through the practice, any insights, insights we could share at any time. But I think that that's a really critical component of trust building, is letting them know that you are a side partner who's not trying to take over their own team, right? So that's something important.
Completely agree that coordination is absolutely key. In terms of, well, what else does it take to empower this? I think one of the biggest things that we find is making sure, right, that your tools, your, care teams, your infrastructure, all really aligns with what some of these different goals are. Eric mentioned it earlier, but I think one of the biggest things is really trying to take what we call a payer agnostic view, right? Even if your ACO only serves one line of business, you're specific to Medicare, or, you're specific to one different type of health plan, or only Medicare Advantage lives. How do you think about really making sure that this ties into everything else that the practice is doing? For example, we should see a lot of organizations focused on Medicare or Medicare Advantage, and oftentimes that's not a gigantic percentage of the overall patients panel, especially for some of these smaller MA plans that are kind of first getting started. And so it's really difficult for these providers to say, hey, each NPI, let's say they have about 2,000 members on their panel, right? If you only have 50 of those 2,000, it's really difficult for that provider to build a whole new workflow, go to your tool, come up with this whole idea of, how do I make sure I'm driving results if it's that small percentage of their panel, right? So how do you think about positioning them with things they can do and use across their entire panel, right? And really making sure that fits into the other different types of technology and other different types of resources that they're using. I think where technology can also help is this whole idea of being able to track and pay out these types of incentives at the individual level. It's really difficult to be able to track, well, who's done which piece of this workflow? How are we making sure we're figuring out where in the process did it fall off, right? Hey, we know we're, again, just to stick with the same example, behind in colo screenings, but is that because we're never talking with these patients about colo screenings? Is that because when we send them to GIA, it happens 90% of the time, but when we send them to GIB, it happens only 20% of the time, and it's really a problem with scheduling at GIB, right? Where is the process falling off, and how do we make sure that what we are prompting, right, fits into the overall way in which they're really thinking about this? And so, Eric, I know your team has spent a lot of time thinking about how do providers, fit in Stellar, other different types of technology into kind of their suite of services. If there's any other further color you want to share there.
Yeah, a couple of things. One, it's interesting because we work so closely with Stellar. When they introduce us to a practice that's using Stellar for an MA plan, for example, we tend to find that those practices are rock stars right away. They already, first of all, they believe in that software, but they're already understanding the flow and appreciating how it simplifies things. When we start to work with new practices, one thing, of course, you get pushback, right, from a lot of new practices. And so we do references and, have referral forms and such. And one of the office managers said on one of the calls, and one of the doctors said, interestingly enough, not prompted at all, that it actually makes their life easier. And some of these models that we institute, it actually saves them time. So the first reaction you'll get from a practice could be pushback, right? Or it could be, thank you, I'm looking for a solution. So I found that practices who are open to these types of things then tend to be more successful because they're open to carrying it over to other lines of business. And I know Zach talked a little bit about this, about if the practice only has 50 patients out of 2,000, they're probably going to be less engaged because it's less money and doesn't cover as much of their whole practice. But if you look just at, for example, ACOs, Medicare fee-for-service ACOs, that's probably 25% of their business for many of these practices. So they very quickly want to get engaged in that because it's a big part of what they do. I know we talked a little bit about other tech, but when we try to take all of the other tools that we use in terms of technology, like I said earlier, we just try to simplify that information to them. We offer the single sign-on type tools, where Stellar's on that platform to kind of make one less step for the practices. I mean, that's not like, creating sliced bread or anything. That's not something new, but that helps facilitate usage of some of these other technologies. And sometimes docs want to have nothing to do with the other tech. They're like, tell me the information and I'll act on it. And sometimes they say, I'd like to see everything. So this way you can offer it to them and let them make the choice and say, hey, if you don't want to have access to this other tool, when we connect periodically, we would like to share this with you. Great. And then can you get this into my EMR? Yeah, here's this PDF, upload it to the PMR. So sort of like a seamless sharing of information without increasing their work, but sharing, so they're kept up to date and everything really seems to work well.
Agreed. Maybe just being conscious of time, I want to make sure we do save some time here for questions. Just a few of the kind of summarizing things really just to take back as you start to think about this, right? Number one, how are we really making sure that we're aligning the different types of value-based care tasks, right, with who are the right individuals? How does that fit into what it is that they're doing on the day-to-day basis? How does that promote teamwork, right, and be able to help standardize their process across the board, not just within, your individual ACO, but actually fits well with the way in which they think about doing things, really in order to help improve this whole idea of staff satisfaction, reducing turnover, right? How are we making sure that, the doers of this different type of work really feel like they're being appreciated and rewarded appropriately? And how does all of this really start to lead to better patient practice results that help drive overall, financial rewards? To Eric's earlier point, right? How do we make sure that incentives throughout the year are tying to what it is that creates a bigger pie over time, right? And that's really how you get everybody to start marching in the same direction. And how do you make sure that the different tools, resources that you put in place are really driving towards that? Just quick in terms of kind of some of what we've seen. Again, we are really focused on this whole idea of the day-to-day activities that providers and staff do, making sure you reward them. But in order for that to prove successful, it's got to be able to drive, significant results. So we've seen, full star improvements, coding gap in terms of improved coding accuracy, all the way up to, 0.1, 0.2, just kind of depending on where the different starting point was, right? So again, all of these different types of incentives, they do take some investment, some shift in culture in terms of being able to drive to that. But that's really how, we've been able to see some of these different step change results. And Eric, I know, Vitalize has often seen a lot of these different types of results as well.
Yeah, just quickly, I'll add one thing. I mean, it's no surprise, right? Everyone's looking for savings and shared savings, and you're not going to get it every year, but you try to get it most of the years. And, one thing we found, we did a stratification on engaged practices versus less engaged and then not engaged. And the engaged practices lowered costs, somewhere around 15%, whereas when you look at practices less engaged, it's 3 to 5%, and not engaged, of course, close to zero. But, as you guys collect for your own organizations, there is success rates. It's a great way to sort of help practices understand, listen, this works, right? Being engaged works. And then we didn't talk a lot about patient engagement, but it's all the same thing. Good luck trying to get patients engaged. They're hit with a million different places, but as they see that the practice is engaged and everything is sort of in line with what patients need to do to achieve better health, patients tend to get more engaged as long as they're not overwhelmed and it's simple, timed out that works into their life, then you lead to better outcomes for patients, which is what these practices are all really looking for outside of the finances.
Agreed. Definitely overall goal really being, how do we make sure all of this matches up to improved outcomes, both for their patients, right? Better experience for the providers and their staff, all to lead to overall results. So with that, I know we've got about 10 minutes left. Happy to open it up to any further questions. Maybe Garrett will call you back in. I think we had a few come in.
All right. Yeah, well, great presentation, guys. And yeah, we did have a few questions that came in, actually several, and we'll get to as many of those as we can. The first is, and these are in no particular order, by the way. The first is, how can we empower practice staff without overburdening them?
Yeah, that's a super critical piece of this, right? Is how do we make sure that this really fits into what they're already doing and thinking about? And I think the biggest piece of this first is recognizing that, hey, a lot of the staff are actually doing some of these things already, right? And how do we make sure we're actually rewarding those different activities that they're already doing and also helping make sure that we're prioritizing, right? Great example is calling patients to get them scheduled for visits, right? Oftentimes you've got practices spending a lot of time doing this. They might be filtering A to Z, right? They might call the same patient over and over who has had, difficulty getting in, and they're hitting their head against the wall trying to get that patient in, right? So how do you make sure, number one, you are recognizing and rewarding them for the stuff they're already doing, right? That takes a lot of the time out of their day. Number two, how are you helping prioritize that effort, right? So that, it's not even necessarily always additional work, but a shift in, hey, that next call, who should it be to? How should you think about that? And then third, as they start to build up this muscle memory, right, and the workflow starts to improve, how do we make sure, right, that we are taking the appropriate next step, right? You can't throw everything at them all at once, but how do we make sure, where is it we want to focus? Hey, we're doing well on quality. Let's shift a little bit more focus to coding accuracy, right? And how do you make that dynamic and make it so that they can see what the path is, right? It's not about going in and kind of breaking workflow and starting over. It's how do you take kind of that next incremental step based on what their workflow looks like, and making sure you're rewarding early and often, right? Some of the times so we'll cut checks typically on a monthly basis. Sometimes we'll bring the first check after a week or two, right? So there's actually this whole confidence of, hey, this isn't just another thing I'm getting promised. Yeah, hopefully someday I get some extra bonus, right? They can actually track in real time, see how this is leading to better rewards for both themselves as well as the practice and the patient.
I just add quickly a couple notes, practicality. So sometimes practices are like, okay, I can make a little extra money, but I don't care, right? If this is going to make my life worse. So two things I'd say, especially with the Stellar tool, what it does is it takes all of this information and really simplifies it and just sticks it right in front of their face for a particular patient. So they can actually go into that area and find all the information they need, as opposed to looking back on all these other charts and previous visits. So let's say they spent 5 minutes looking back on stuff, and even if it saves 0 time, they spend equivalent amount of time, let's say, using the Stellar tool, right? I'm just giving an example. That nets at 0, right? So overall, plus or minus, it's different. So it simplifies. It's just a smarter way of doing things. So it simplifies. And so overcoming that challenge of doing something different is probably the biggest challenge, and letting them understand the time savings will be there. It's not more work. It's actually just an easier way of doing the work. And the second thing I was going to say is something that, like, we do at Vitalize. We're building in-office technology that would work with any practice, and we're going to customize things based on what practices need. There's so much time wasted in every single practice, taking pieces of paper and moving it from here and moving it from there. So an outside force kind of evaluating that and helping simplify that, they'd be like, wow, right? Because you just think, if a practice is fearing calling a patient because the patient's going to be annoyed, well, what if, maybe, here's an example. That patient says, I have no way of getting to the office, so stop calling me. Well, like Zach talked about, social determinants of health, working with our organizations, or however it works, figure out how to get a ride for that patient. Guess what? They don't have to go to the emergency room in an ambulance. They just saved 4 hours. They then got a better appointment with the doc that they want. So some of these different approaches really can make life easier, even though in the beginning it seems, it's different. So that's kind of what I would say there.
Yeah, great responses, guys. We do have a few more questions come in, so we're going to try to get to as many of them as we can. Second question is, does an incentive program to reward practice staff mean that physicians will receive less revenue?
So it really, what we find, doesn't, and the reason for that is can be twofold, right? Number one can be, oftentimes, we've actually partnered with health plans and others who are willing to set aside extra dollars above and beyond what providers already earn, because they know it's going to the staff to be able to drive these extra results. I think second, and even more important, is this whole idea that Eric talked about, where the whole point of these is, how do you take $1, $2, $3 PMPM and really use that as fuel for the fire for bigger incentive checks for the provider groups at the end of the year, right? These are all intended to be things that directly tie to improved results, again, whether that be quality results, where you have a gate on your shared savings, whether that be total cost of care improvement or coding improvement, right? The intent is for these to be fuel for the fire to drive bigger checks, both for the ACO to share in, as well as, the providers. It does take a little bit of a leap of faith right in the beginning, which can be difficult, but as they start to see these results come in, right, and as they start to get, right, one of the things we think a lot about is it has to tie to, not only the ROI, but also what matters from a take-home perspective. An extra couple $100 a month to medical assistants, others, really goes a long way. We've had, staff cry on team's shoulders of like, hey, this covered my, utilities bill that I didn't know how I was going to do otherwise, right? And for a provider, it's got to be a few $1,000s a month in order for it to matter for them and to be able to drive that, right? So how do you make sure that we're putting an appropriate amount from an ROI perspective, from a take-home perspective, but enough that we feel like it's truly going to drive, fuel for the fire?
That's great. Yeah, no, that's really good. Next question here is, and I like this one. What three particular value-based care incentives have resulted in the best ROI? And what about the AWVs?
Yeah, I can share here quick, and then Eric, curious just from your thoughts in terms of things you guys have found most valuable. One of the biggest ones has been coding accuracy to start. Again, will depend a lot on where your group sits in terms of benchmark. The way we kind of think about it is you've got to have a good benchmark before you try and start to drive total cost of care and other initiatives, which is a lot harder. It's a little bit easier to make sure your benchmark is appropriate upfront from a revenue side perspective. But again, just depends a bit on where you sit from that front in terms of things like code recapture percentage. We've also seen a really big piece of this be around transitions of care, right? The whole idea of readmissions, helping prevent ER visits has been another big bucket. And then also the whole idea of really what I would kind of broadly put in the referral management bucket. Yes, piece of this is kind of site of service, but there are also other ways in which we think about referrals in terms of one of the things we worked on with Vitalize is this whole idea of enrollment actions, right? They've got great programs around chronic care management, behavioral health, remote patient monitoring. What it's difficult to do is to actually get patients to participate in those. So one of the things we did is we actually built an action to say, hey, here's a patient who is eligible for this program. We think it will be good to drive savings for them. Doc, just spend the extra 5 minutes convincing them to participate and we'll reward you for taking that time. And we started to see, actual enrollment in those cost saving programs really drive up.
Yeah, one thing I'll add super quickly to that is scheduling follow-up. And that's a component of the Stellar tool. How often, all of us, you leave the doctor's office, you know your action items, and then guess what? 5 minutes later, you forget and you don't do it. Maybe you called the office once, they couldn't talk to you or they didn't have an opening when you wanted. So really, they tell you to get a colonoscopy, making sure it happens, right? There's got to be a huge drop off just in general for every practice with those types of things.
Very good. Well, we have time for one last question, and unfortunately, we've got some other really great ones in here. So if you have one and you're out there, please go ahead and submit it. Again, we will answer those via email afterwards. But the last question we have for today, and I like this this one. This will be interesting. Is what criteria do you use to quantify the value of staff A's activity versus staff B's activity, and how do you resolve any conflict if they disagree?
Yeah, I love this question because I think step number one is how do you actually measure what it is that they did, right? In terms of being able to tie something to that. We do it in two ways. Number one is we actually do track how many actions did they complete, how many patients did they call, right, on a kind of workflow task standpoint. Number two is what we actually do, and kind of alluded to this, but we assign what we call stellar value units, SVUs, as a play on RVUs, to each of those actions, where we can actually say, hey, this action is worth 10 SVUs. This action is worth 20 SVUs. We like to tie those as much as we can, one-to-one with dollars, right? But again, it's another way to kind of weight some of these different actions as to what is the one you really think is most important to get completed. At the end of the month, we'll then know exactly staff A, staff B, how many actions did they complete, how many SVUs did they earn, and then we've got flexibility in the model around how we actually reward that, right? Again, the more closely tied to who did what, right, the better. But we have plenty of practices who say, hey, culture-wise, we want to make sure, both front desk are sharing the same pool because, yeah, one schedules AWVs, one calls to get colo screening results, but they're both important, right? We want to make sure that they're view it as teamwork. So all of it is flexibility. But I think step number one is how are you actually tracking what it is everybody did? How are you tying these different types of incentives to them? And then on the back end, you can start to create flexibility based on, the culture and staffing structure of your group.
Oh, that's cool. That's a great question. Unfortunately, that is all the time we have for today, guys. Thank you so much, Zach and Eric. This was a wonderful presentation, and look forward to hearing more from both of you later on. But at this time, unfortunately, we're going to have to wrap up. And as we conclude, I wanted to encourage you all to go visit the Stellar Health exhibit booth at acoexhibithall.com. And here's where you can interact with their team, learn a little bit more about what they're doing, spend some time just really looking at some of what they have to offer. And there's also a lot of other tools and articles and webinars and such in the ACO Exhibit Hall library, which is also, by the way, where you'll be able to find the Stellar Health webinar from today. It'll be archived there in the library. But I will be sending that out to you afterwards. So you'll be getting an email from me later on this afternoon. And then lastly, if you have any questions for Zach or Eric or any of the Stellar team, please feel free to reach out to them directly. Eric, or Zach, if I could have you go to that last slide, there you go. You'll see the contact information there for them, and you can reach out or you can reach out to me if you have any questions. I'm happy to facilitate an introduction and help you get in touch. So thank you all again for attending today's webinar. This is a great and informative session, and I hope you all have a wonderful rest of your day. Thanks again for coming.
Thanks, Garrett. Thanks, everyone.